Hello students, today we are going to discussing about the hospital pharmacy communication. We also call it as a newsletter. Here see the definition of the newsletter. A newsletter is a printed report containing news of the activities of a business or an organization. Okay, pharmacy newsletters are an important communication tool for the majority of pharmacy operations across the country. Here normally in every hospital or in a pharmacy to share any new information about the treatment, diagnosis or anything to doctors, nurses or other persons who are working in the hospital or the pharmacy, they will provide the information in a written printed format. That written printed format only call it as a newsletter. For sharing the new information, we are printing that information in a paper and we are distributing to the persons who are working in the hospital. That is called a newsletter. Newsletter is one type of newspaper. Even newspaper also call it as a newsletter. In newspaper daily we will get the newspapers. In that we will get the all new information that is done across the country or across the state. Like that in newsletter we are going to giving the information, new information about the hospital or new information about the pharmacy. Okay, normally these newsletters are used by the pharmacists for basically two purposes. First one is to disseminate information to physicians, nurses and other hospital staff for public relations. Second one, to communicate the decisions that are made by the pharmacy and therapeutic committee. Okay, first we said that we are going to disseminate or informing the information, new information to the physicians and nurses. What the information normally we are going to disseminate the people, like latest information in medical sciences, any newly introduced drugs, any newly introduced indications, any new drug delivery systems or any updates on drug interactions and adverse drug reactions. Not only that, any medication safety information and precautions, like that any new information, new things about the drugs that we are going to sharing with the physicians and nurses and other staff who are working in the hospital by the pharmacist. Second one is to communicate the decisions made by the PTC. The decisions normally taken by the PTC are drug use policy, revising drug formulary and ADR monitoring programs, drug product defect reporting programs and drug utilization review. Any decisions that is taken by the PTC on these conditions, they are going to informing to the all staff by the pharmacist in a printed format. That printed format only call it as a newsletter. Okay, next we will see the layout of the newsletter. In the layout of the newsletter, first we have the selection of the title, next contents of the newsletter, format and printing, distribution and advantages. Here first one is selection of title. The title should be specific, that means it should be clear and unique. That means we are printing the new information we are printing in a paper. For that printed paper we want to keep one title. That title is like, it is like pharmacy review, it is like pharmacy news bulletin or pharma times. Anything like we can keep any one of the name from the examples. Like that it should be specific and clear and it should be unique. Next we have the contents of the newsletter. Here what and all things will be included in our newsletter. First one is editorial column. Here editorial column means here we are going to including the person names and designation who are going to preparing this newsletter. Next the new drug selection. Here we are taking decision anything about the new drug, that information we are going to included in that. Next the abstract. Here abstract means the brief summary about the contents which are going to include in our newsletter. What and all information is there in the newsletter, that we will give it as a conclusion based, like it is like we will write as a brief summary, like summary thing like we'll write in first, that is called abstract. Next, medical staff. Medical staff means if they selected any new drug or say they selected any new indications, who selected that new drug, who selected that new indication, who selected that new drug delivery system, that doctors, that medical staff name will be included in our newsletter. Next, any new discoveries, any new delivery systems are there, that information also we are going to including in our news. Next one is format and printing. After preparing the newsletter, how we are going to putting it as a formatting and printing. Here, structure of the bulletin varies with organization of the pharmacist. In different hospital, different pharmacists will be there. According to the pharmacist interest, according to the pharmacist knowledge, they are going to be keep this structure of the bulletin or structure of the newsletter. Normally this publication means that newsletter we are going to print it on a royal bond paper. That paper will be sizes measuring from of 8.5 to 11 inches royal bond paper. On that royal bond paper only we are going to making printing of our new information. Okay, next one is distribution. After preparing and we are going to printing, next we are going to distributing these newsletters. To whom we are going to distributing these newsletters means distributions to the medical staff, library, administrative block, nursing services, laboratories and public or patients. For anyone we can distribute these newsletters in the hospital. Next, what are the advantages of this newsletter means news bulletin will have lot of information regarding a particular content. Okay, if we discovered any new drug, okay, if we discovered a COVID vaccine, in news bulletin we will give the all information regarding that COVID vaccine. It contains the full information about the one particular drug. Next, this means the better communication compared to the telephonic and verbal communication. That means if we say in telephone about the new drug, otherwise if there is any face-to-face communication, if there is any seminar, we can't give that much information about that particular drug, but that information we are searching and we are typing in and we are giving in a written format, then we will give lot of information about a particular drug. This is about the advantages of the newsletter. Normally for communicating any new information, communicating about any new information, we will use this newsletters in the hospital pharmacy. Otherwise that newsletters have no use other than that. If you want to communicate large messages, if you want to communicate a lengthy messages or lengthy information to the medical staff of the hospital, then we will use this newsletters.